So, thanks very much for joining me this afternoon. It's kind of a stormy day here in Cape Breton, and people are locked in essentially, which is what people have been doing for quite a few weeks now due to the virus. And it's interesting, difficult times for everybody, and new thing in many people's lifetimes, and a lot of people are quite concerned and anxious about the virus. So I'm going to talk today, I hope, about some things that can perhaps empower you to take some of that energy. Anxiety, concern is an energy. We can take that energy and we can hopefully shift some of it into positive, empowering direction. And when we get a sense of that there are actually things that we can do to help ourselves to improve our response to the virus, improve our immune reactions to it, I think that's quite a positive thing. So I'm going to share with you some very interesting insights that I learned due to the lockdown conditions myself. I've had the chance to take some classes from Cornell University that I've been wanting to finish up for quite a while. So that's given me a bit of extra time to do that. And through that, a lot of connections have come together for me with some real interesting insights into nutrition and the coronavirus that we're now all facing. So let me just switch over to some slides and share that with you, and I'll go through some quite interesting things that I hope a lot of us have extra time for cooking, thinking about food, thinking about having the time to cook and think about nutrition. So I hope some of these insights will be helpful for you. And please bear with me because a little bit of technicality in places, but it'll be worth it in the end. So one of the first things is to have a sense that the virus itself is the SARS virus. This is the second one. And that's distinct from the disease itself, which is COVID-19. And many people from recent testing are getting this virus and having mild to no symptoms. So the question is, why are some people getting a much more severe course of the disease? And other people have very, very mild case and even in some cases minimal symptoms from it. And what's emerging is what people call comorbidities. So there's a pattern, and the pattern is in particular older people, but not just older people, very much connected, 90% or more connected to what people call comorbidities, which is problems, health issues like hypertension, obesity, cardiovascular disease, diabetes. So they're very familiar to most of us, these very common diseases. In fact, really, they're the diseases that most people end up dying from in our society. We also have respiratory problems, COPD, which itself is 90% due to smoking. So if we look at that, it's very interesting because normally what we see with viral infectious diseases is that children are disproportionately affected because their immune system is considered to be immature. Older people are affected because their immune system is waning and it's not as effective as when they were younger. So, you know, that's the typical assumption is that older people are disproportionately affected from this virus because of their waning and aging immune systems, but that might not be the right picture. When we consider that children who also have immune systems that don't work well because of their immaturity, they are not um, very much affected. I mean, there are children who can be affected, but for the most part, their risks from the virus are far less, for example, than their risk from automobiles and being around driving in a car on a regular basis. And also, interestingly, the data isn't fully in yet, but immunosuppressed patients who, for complex reasons of their medical history, have perhaps taking medications that suppress their immune system, they don't appear to be at a hugely greater risk from severe complications, while they would normally be from standard viruses. So this is a very interesting picture. And as I reflected on that, in very much people would describe it, instead of a U-shaped response curve, we have a hockey stick, in that young people aren't affected very much, and it's not until we get older people. But it isn't just the age, it's very much associated with these particular comorbidities. So the question is, why could that be? And I had some insights that I'm going to share with you that I think are extremely important, and please share them with other people, because I think it's quite important, so you can judge for yourself. Well, let's just take a look at the kind of factors that actually are the most important factors that relate to morbidity, people actually dying in our society. I think it's extremely important to understand that. This is data that ultimately was paid for by Bill Gates himself, who's become quite a philanthropist in his retirement, and is actually sponsored research to help people to put together all the data on how people, what are the risks and how can we improve global health in particular. So this is from the Global Burden of Disease study that was done by hundreds of researchers from dozens of different academic institutions. This is data from 2010 from the United States. But if we look at the very top, what we see is dietary risks, tobacco smoking, high blood pressure, high body mass index, physical inactivity, high blood sugar, diabetes, essentially, high cholesterol. Essentially, if we translate these same things that we die from in normal times, these are also the same comorbidities that predispose us to having much more challenging time to fight off this coronavirus, which is an extremely interesting connection. So these same comorbidities, from a nutritional point of view, could there be a connection between nutrition and these particular diseases that are so common, and our immune response to the coronavirus? And I have came across the connection, and I think it's very important that I try to share it with as many people as I can. So this is my nitric oxide theory. So let me take a little bit of time to explain it. Nitric oxide is a gas, and its role in physiology is relatively new on the scene. I'm not that a young person, and when I was in university, this just wasn't in the textbooks. So it's very exciting for me to have a chance to take some classes at Cornell and hear about nitric oxide. And in particular, I was learning from Dr. Caldwell Esselstyn, who is one of the leading experts on reversing cardiovascular disease with nutrition. So 1998 was the Nobel Prize was awarded for the discovery of nitric oxide in physiology. Um, and it turns out that the cells that line our blood vessels and many other cells produce nitric oxide. Some of the effects in the cardiovascular system, it actually helps to keep our vessels like Teflon so that nothing sticks. All those cholesterol and fatty particles that can build up and cause plaques and ultimately cardiovascular disease, that Teflon-like effect helps to prevent that. Also, it helps them to dilate so that we have very flexible arteries that can loosen when they need to and respond. And so that prevents us from getting hypertension, which of course is something that's very common with age, but it's not aging as much as it is the cumulative effect of a lifetime of nutrition that damages the nitric oxide production in cells. So the production of nitric oxide is very much connected to health and aging. Very, very much connected. And I'll take you through a little bit of that. Here's a paper, fairly recent paper, aging of the nitric oxide system. Are we as old as our nitric oxide? Typically, even by our 50s, people are producing half as much nitric oxide as they would, say, in their teens or early 20s. So it's that deterioration of the cells that produce the nitric oxide that is very much associated with aging. But it isn't just aging, but it's very much, again, I want to emphasize that, it's the cumulative effect of a lifetime of nutrition that can support our nitric oxide production or conversely can be deleterious to it. Now, here's the thing. Within our, if we think about the surface area of our vascular system, just imagine a football field, a whole football field. That's a huge area. Well, that's roughly the area, the surface area of our vascular system. So you can imagine within us a whole football field area of cells that can produce nitric oxide. I mean, that's the scale of it is quite staggering to me. So, and of course, one of the things we notice with this paper is the connection between, as I've highlighted here, aging is associated with a marked impairment of the determinants of nitric oxide generation, and it's very much connected with adverse impacts on cardiovascular outcomes, high blood pressure, cardiovascular disease, many of these other comorbidities that relate to the coronavirus. But here's the thing. Nitric oxide is not just a cardiovascular question. It also very much is part of the immune system. If we get bacteria or viruses, as the immune responds to them, one of the things it does is it ramps up the production of nitric oxide. So nitric oxide is part of our immune response and is known to help us kill off bacteria and viruses. The first SARS virus, there's a paper, and I can share that with anybody who is interested. Nitric oxide is actually lethal to the first SARS virus. So we could easily assume that it's also can be lethal to the second SARS virus. Now, I'm not the only one to make this connection. Within the medical community, there's an awareness of it. And in fact, nitric oxide is being used in a clinical trial as a treatment to inhale the gas with patients to use it to see if it can actually be an effective treatment for COVID-19, the disease caused by this particular coronavirus. So that's an extremely important connection. You can see all the comorbidities, or many of the comorbidities, are connected to cardiovascular problems, which connects to nitric oxide depletion. Nitric oxide is part of the immune response, and specifically can kill off the coronavirus. So there's a connection that helps us explain why young children are not so much affected by this particular virus, because young children can very effectively produce nitric oxide. Their cardiovascular, the cells lining their cardiovascular system are still very much pumping out lots of nitric oxide, and it takes years of poor nutrition to help to damage those cells and to really deteriorate the ability of those cells to produce nitric oxide. So there's the connection. Nitric oxide, cardiovascular diseases, nitric oxide, part of the immune system. But is there anything we can do about it? I mean, that's the key thing. If this was just a question of describing something without having any good news, I would be fairly reluctant to want to share it with you all. But in fact, there is a lot of good news that can be shared. And the amazing thing is that even a lifetime of damage to the cardiovascular system, the nitric oxide system, can be repaired. So this is an example. This is data taken from Dr. Caldwell Esselstyn's, one of his books on reversing coronary artery disease. We can see quite a diseased artery on the left side with a patient who came to Dr. Esselstyn, who, instead of bypass operations and stents, opted for a really radical nutritional intervention as per Dr. Esselstyn. And you can see that this highly damaged artery repaired itself and looks much, much healthier. And in fact, if you look at the symptoms and the cardiovascular events that occurred in the patients that Dr. Esselstyn worked with, it's really the most effective treatment for cardiovascular disease, when appropriate, that has ever been discovered. So, and in fact, let me just interject. I was extremely excited to see Dr. Esselstyn actually came to our community of Sydney, Nova Scotia, a few years back, and one of my good friends was very astute that she's an audio visual specialist, and she recorded his talk and that of his wife, Ann Esselstyn, who is an amazing human being herself, talking about what people have to do to implement this kind of a radical nutritional intervention to essentially reverse coronary artery disease. And of course, high blood pressure, high cholesterol, same dietary pattern can also reverse type 2 diabetes. So that it's a clear common underlying cause. And from Dr. Esselstyn's explanatory framework, nitric oxide is key. So by protecting and supporting and restoring our nitric oxide system, we can actually reverse cardiovascular diseases. And what I'm suggesting in this talk is that dramatically changing and repairing and boosting our nitric oxide system also has immune activity very much against this particular coronavirus. That's my hypothesis, and think about it for yourself. Let's embark a little bit more on the issue of the nitric oxide. So how do we actually get more nitric oxide into our systems? Interestingly, there's two distinct ways. And you could imagine that the kind of dietary advice wouldn't be surprising to anybody. We need to eat a lot more vegetables in particular. And in the green leafy vegetables in particular are the ones that can really impact nitric oxide. So people ask Dr. Esselstyn, well, Dr. Esselstyn, which green leafy vegetables are they? And this is his answer. I haven't got it memorized yet, so I'll read it off a list. Bok choy, Swiss chard, kale, collard greens, beet greens, mustard greens, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, arugula, and asparagus. His top 5 are kale, Swiss chard, spinach, arugula, and beet greens, and beets, even though they're not green leafy vegetables. So there's actually 2 particular pathways to increase the nitric oxide. The first pathway actually produces nitric oxide from nitrates in the vegetables. So vegetables, many of these vegetables have nitrate compounds. And when we eat them, the nitrate compounds are converted by your mouth bacteria to nitrites. So there's a conversion. But don't use mouthwash. Let me say that again. Do not use mouthwash. Mouthwash kills bacteria. Not all bacteria are bad. Many bacteria are good. In fact, we have these wonderful bacteria that reside in our tongues. And those bacteria convert the nitrate to nitrite. Then, once the nitrite is in your stomach, the nitrite can be converted by the acid to nitric oxide, which can then circulate in the body to produce its amazing effects. In the intestines, there's nitrate and nitrite left over, and some can be excreted by the kidneys, but some of it actually can circulate back into our mouth, in through the saliva, where the bacteria get another kick at it, and they can convert it again. So we have this whole cycle happening, and that's why saliva, don't waste your saliva either. Don't be a spitter. Use your saliva. Don't use mouthwash. Eat lots of vegetables from that list, and you're going to directly increase the nitric oxide in your system in a very direct way. The second pathway, well, here's a little introduction on nitric oxide again. 1998 again, Nobel Prize in Physiology and Medicine awarded to a team of 3 doctors who identified nitric oxide and its important role in the cardiovascular system in particular. And since that time, nitric oxide has been extensively researched and linked to numerous physiological and pathological processes within the cardiovascular system. So, you know, it's a key part of peripheral vascular disease, pulmonary hypertension, wound healing, heart attacks, you know, many aspects. So a lot of research today on nitric oxide. And if you haven't heard about it, I'm sure you're going to hear more about it. But the second pathway to nitric oxide production in our bodies is actually our own cells producing the nitric oxide. So I'm not going to take you through all this complexity of biochemistry, but there's certain enzymes and that stimulate you know, help nitric oxide to be produced so that nitric oxide can be released by the endothelial cells. I think the key message here is, once again, how can we, you know, from a nutritional point of view, we can eat foods with nitrates and that will be converted into nitric oxide. But the other message is, how do we make sure that we maintain the cells of our vascular system to optimize their nitric oxide production? 2 things. One is, do not eat foods that damage your cells. And guess what? There's absolutely no rocket science here. I think everybody knows what kind of foods can significantly damage our cardiovascular system. They're the same ones that are going to raise our cholesterol, I mean, it's fat food, fast food, greasy, um, sugary foods with no nutritive value, uh, all of those kind of foods that we all know aren't good for us. Um, those are the foods that are going to cause the damage. At the same time, green leafy vegetables, all kinds of whole grains, fruits, legumes, nuts and seeds, all of these kind of whole plant foods uh, are very powerful for maintaining and supporting our whole system. But the green leafy vegetables in particular are very helpful. Quick little story about a wonderful study in Okinawa, where the Okinawans are famous for a long life. And of course, now their diet has changed for the worse, unfortunately. But they did a very interesting, cool study where they took Okinawan women, divided them into two groups. One group just maintained their normal diet, whereas another group was given a basket of 6 different kinds of green leafy vegetables every day. Then, as the weeks passed, they measured the cells called that help to regenerate and restore the endothelial progenitor cells that can actually support any damaged kind of cells in the endothelium, which is the lining of our vascular system. These cells come from the bone marrow, and when the green leafy vegetable consumption dramatically increased the endothelial progenitor cells and really helped to support the regeneration of the endothelium, so regeneration of the whole cardiovascular system. So what are the key points? First of all, nitric oxide appears to be a very important pathway relating to our health, the lack of comorbidities, and also our ability to optimally respond to the virus. Even if it isn't, taking these nutritional steps to reverse these comorbidities can only help in optimizing our ability to have a positive outcome. So even if my theory of nitric oxide is way off base, which I don't think it is, check it out for yourself, share it with other people, and investigate yourself. But even if it isn't, if you do not have high blood pressure, which in a few weeks' time, if you embarked upon these kind of very dramatic nutritional changes, even in a few weeks, if you have high blood pressure, a few weeks later, your blood pressure will be dramatically lowered. It can take quite a bit of a longer time to completely reverse the, say, the plaque buildup in your arteries, but symptomatically, you're going to have more energy. You're going to have, if you're a person with angina or peripheral vascular disease, your symptoms will improve in a very short period of time. So it's very important to realize that, but there's other two key points that go along with that. One is I'm not suggesting that you can eat really well and then you're bulletproof. You don't have to worry about catching the virus or sharing it with other people who are elderly and perhaps very at a high risk, people in your family, other members of our community. So please don't get that message. The message is to follow all the public health guidelines to reduce your chances of exposure and certainly to reduce your transmission to other people that are the most vulnerable in our society. The other important caveat is that these nutritional strategies are so powerful that they can improve your health so quickly and so beneficially that you may have to reduce medications. If you take medications for type 2 diabetes, high blood pressure, those can change so beneficially so quickly. It's amazing. I've worked with people, and just like I say, in weeks, they can go from high blood pressure to no high blood pressure. Clearly, if you're on medications, that would have to be discussed and monitored with your medical doctor. and they'll probably be very excited to see you take these positive steps towards your own health. Maybe something that would have liked to have encouraged you to do for many, many years. So what are the key nutritional strategies for reversing comorbidities, producing more nitric oxide? Essentially, it's a diet that people have described. Colin Campbell at Cornell, I believe he was the one who coined the term a whole food plant-based diet. Mostly eating as many plants as possible, predominantly plants, and whole foods, not processed foods, not sugar, dumping oil and sugar and all the kind of foods, the white flour and all the kind of unhealthy foods that really unfortunately make up a large proportion of the standard diet these days. One of the interesting things about Dr. Esselstyn's approach is he gets his patients to eat green leafy vegetables 6 times per day: breakfast, mid-morning snack, lunch, afternoon snack, dinner, and an evening snack of kale. I'm quoting Dr. Esselstyn. With a little bit of vinegar. Vinegar also helps this process along too. Don't eat foods that damage the blood vessel linings. So clear what those are. I don't think there's any mystery over the things one shouldn't eat. And of course, switch to as much plant protein as possible. And the secret with plant protein are legumes, beans, pulses, whatever you want to call them, chickpeas, lentils, black beans, pinto beans. As we're speaking, I have some pinto beans cooking in my pressure cooker. Why beans? Well, beans are not damaging like the foods that they'll replace, and they themselves are the nutritional superfood that you never hear about, and they're extremely inexpensive. Check this article out for yourself if you don't believe me. Legumes, the most important dietary predictor of survival in older people of different ethnicities. Check the paper out for yourself. Read it. If you smoke, you can take, on average, about 7 years off your life. That's one of the worst possible things that you can do for your health, is to smoke. Clear enough. But if you eat legumes regularly, beans, chickpeas, lentils, etc., you can actually add 5 years to your life, probably bigger than any other single dietary intervention. I mean, many people are worried about superfoods, all these kind of obscure things that are being promoted. But the true secret to base your diet on are the legumes. So you can see the picture. Whole food, plant-based nutrition very much comes down to, where do you get this from? Where do you get that from? And the answer over and over again is greens and beans. Greens and beans. You want to eat green leafy vegetables regularly as a good foundation of your diet, and the pulses, as the British call legumes, beans, all that kind of thing. And of course, I'm not talking about beans with molasses and pork, as is common here. So many different ways of cooking, and in future courses, sessions of this nature, I'll talk more about how do you actually implement these changes, put it all together, and make it happen. It's not an easy thing to make a big change like that. There's social and psychological barriers. There's something called the pleasure trap, which I'll talk about in the next session. And there's a lot of skills and habits to acquire, and tastes, of course, too. You need to change your taste preferences, which is very much built into the pleasure trap, which I'll pick up on in the next session. As well as tied into the pleasure trap is the idea of what people have come to call ultra processed foods. And I'll just skip over this very quickly in this session, but if we talk about the plant-based burgers, which are all the rage these days, they're perfect examples of ultra processed foods. So I'll talk about that next time, and how one can actually change their tastes and learn to cook whole plant foods that promote health, promote nitric oxide, reversal of disease processes, and optimum health over our whole lifespan. Let me just finish off this session with a recipe, just to give you a little sampler. This is a very delightful recipe, very simple, very tasty, and very quick to make. Not too many ingredients, and it features that wonderful combination of beans and greens. So in this case, we have chickpeas, we have some onions and garlic for flavor, and we're going to use a lot of spinach, 20 ounces of spinach with 2 cans of chickpeas. That's a lot of spinach, but of course, as soon as spinach gets cooked, it immediately shrinks. But still, that's a lot of greens, a lot of chickpeas, very low calorie density. And the key thing is, how do we get the flavor? Well, the flavor in this particular recipe is lemon and dill. Fresh dill is wonderful. If you don't have fresh dill, don't be dismayed, because you can always use dried dill, which you can easily pick up in any grocery store. Fresh lemon juice, much better than actually using bottled lemon, which doesn't quite have the same zest to it. Use as much lemon as you prefer. Some people, I tend to have no limit to the amount of lemon I like. Other people, they find it too acidic, just too sharp for them, too tart. Find that balance for yourself. Same as the dill, you might like a lot of dill. It's always nice to have fresh dill sprigs in there, but you want to cook with some of the dill and maybe have some sprigs on top as well. Delightful, very simple recipe, and it very highlights that beans and green cooking, nutrition, and I think I'll end it there, and I'll maybe take a few questions if we have any questions. I'll switch over to okay, if anybody has any questions, feel free to type them in the chat box. Perhaps somebody has a question. Excellent. So we have a question. What recipes do you offer for greens and beans, other types of recipes? And I think I'll leave that answer with the fact that tune in to me for the next session, and we'll take you through more beans and greens recipes. My interest is ones in the taste, have lots of flavor. You can adapt the flavor preferences to your own palate, and that need to be quick and easy, and how to cook with beans in an effective way. So that's a good question, and I think the key there is tune in next time. And I think that's all the questions we have for today. So please send along any questions that you have, and please tune in next time, and please share this information with friends, family, anybody that you care about. I think if people understand how much power they have in their own hands to transform their health in the long term, irrespective of the virus, but if we look at the different elements of the nitric oxide theory, we can see that the very same things we need to do to improve the conditions that are the comorbidities also explains how we could dramatically improve our immune system physiological response to successfully combat the virus. So thanks very much, and I hope to see you next time. Take care.